Alpha blockers in hypertension. This video represents a focused overview of alpha-1-adrenergic receptor blockers, their mechanism, clinical uses, and adverse effects in managing hypertension. Let us now look at the key examples of selective alpha-1 blockers. Prazosin is a short-acting drug used as an add-on treatment for hypertension. Terazosin is longer acting and is useful for both hypertension and benign prostatic hyperplasia or BPH. Doxazosin is also used for hypertension and BPH, but its once daily dosing makes it the most commonly prescribed alpha-1 blocker due to better patient compliance. Mechanism of action. Alpha blockers selectively block alpha-1-adrenergic receptors on blood vessels, preventing noradrenaline-induced vasoconstriction and causing vasodilation of both arteries and veins. Hemodynamic effects. Let's understand the hemodynamic effects of selective alpha-1 blockers step by step. These drugs first block alpha-1 receptors on vascular smooth muscle. Since alpha-1 receptor stimulation normally causes vasoconstriction, blocking these receptors produces vasodilation of both arteries and veins. Arterial dilatation reduces afterload, while venous dilatation decreases preload by reducing venous return to the heart. Together, the reduction in afterload and preload lowers peripheral vascular resistance and cardiac workload, resulting in a fall in blood pressure. This hemodynamic effect forms the basis of their antihypertensive action. Additional benefit. In addition to lowering blood pressure, alpha-1 blockers offer an important additional benefit. They produce smooth muscle relaxation in the prostate and bladder neck by blocking alpha-1 receptors present in these tissues. This reduces urethral resistance, improves urinary flow, and relieves symptoms such as urinary hesitancy, weak stream, and incomplete bladder emptying in patients with benign prostatic hyperplasia. Therefore, alpha-1 blockers are especially valuable in patients who have both hypertension and BPH, providing the dual benefit of controlling blood pressure while improving lower urinary tract symptoms. Uses in hypertension. First, they are used as add-on therapy because they are not first-line drugs. Instead, they are prescribed as second or third-line agents when blood pressure remains uncontrolled despite standard treatment. Second, they are particularly useful in patients with hypertension and benign prostatic hyperplasia (BPH), as they simultaneously lower blood pressure and relieve lower urinary tract symptoms. Finally, they may be added in resistant hypertension, where blood pressure remains uncontrolled despite treatment with 3 or more antihypertensive drugs. Thus, alpha-1 blockers are reserved for selected clinical situations rather than routine management of hypertension. Special patient populations. Patients with dyslipidemia or impaired glucose tolerance. Alpha-1 blockers have relatively favorable metabolic effects, causing little adverse effect on glucose and lipid metabolism. However, this advantage has not translated into better cardiovascular outcomes, so they are not preferred solely for this reason. Adverse effects. The most characteristic is first dose postural hypotension, where a sudden fall in blood pressure occurs after the initial dose. To minimize this, patients are advised to take the first dose at bedtime. A rapid fall in blood pressure may also cause dizziness and syncope, especially on standing. These drugs can produce reflex tachycardia, although it is less pronounced than with non-selective alpha blockers. Other adverse effects include fluid retention, which may require concurrent diuretic therapy, as well as headache and nasal congestion. Always warn patients to rise slowly from a sitting or lying position. Key takeaways. First, remember that alpha-1 blockers are not first-line drugs. Instead, they are used as add-on therapy or in resistant hypertension when blood pressure remains uncontrolled. Second, they offer a unique dual benefit in patients with benign prostatic hyperplasia, BPH, by lowering blood pressure while simultaneously relieving lower urinary tract symptoms. Finally, always remember the first dose effect. Postural hypotension is the hallmark adverse effect, so patients should be advised to take the first dose at bedtime and to rise slowly from a sitting or lying position.